As a board-certified family medicine physician from a very small town, I've heard it all. You get your good job and your good insurance, right? You wave that insurance card and say, you want me to see that specialist? I got good insurance. I should be able to choose where I can go to the doctor, how I can go, when I can go. That's a tier 3 medication? Not with my good insurance. But let me encourage you to be aware that having good insurance and that insurance card is not enough to just say you have access to good health care. Access to health care should be looked at in 2 facets, that being proximity and communication and conversation. Okay? Let's talk proximity. I told you I was from a small town, right? So Marion, Alabama, I think is the best place in Alabama. But I'm biased, okay? Just a little bit. So 2,994 people. Just 2,994 people in my town. But Marion makes some amazing people, places, and things. Guess who's from Marion? So Coretta Scott King, the wife of the Dr. Martin Luther King Jr., she's from Marion. Jean Charles Young, the wife of Ambassador Andrew Young. Dr. Kathy Trimble, my mama, but she's a prolific educator, and me. So men, y'all just run on down to Marion because they making some good wives down there, okay? But not only are amazing women from Marion, we are the birthplace of the Civil Rights Movement, and we are the home of the Big Bama State, or the Alabama State University. So even though Marion has birthed all these amazing things, we are indeed a healthcare desert. What's a healthcare desert, Dr. Cree? So I remember as a girl, we had a hospital. We had a prolific hospital. But I remember that hospital closing and it becoming a freestanding ER. I remember the ER closing and us only having a nursing home. So now there are 2 nursing homes there, a dialysis center, a couple of primary care physicians. But what happens if you have a true medical emergency? That's a heart attack. That's a stroke. Or ladies, what happens if you go into labor? That can be an emergency too, right? I know of someone who went into labor, called 911 like you're supposed to do, right? And they were like, baby, 911, baby, yes, hello? The ambulance is in the next town that way. Well, I need to go this way. And I need to go 20 miles that way, which takes about 36 minutes to get there. 36 minutes, y'all. That's a long time when you're in labor. So she looks at her husband and says, we just have to go because we got to get there. So they go and they get in the car and they drive. And you're talking about 2-lane traffic. You're talking about lots of potholes. You're talking about no passing zone if you're going to drive the way you're supposed to drive. And that's hoping that you do not get behind a tractor. Now, if you get behind a tractor, that 30-minute drive is gone. So this is not Birmingham 20 miles. This is the country 20 miles. So they get halfway there, and she feels this innate urge to do what's natural. And that's the push. And you know you watch enough TV, and it says, don't push until the doctor, you get to the doctor. Don't push until the doctor says push. And her husband is frantic and tells the 8-year-old to get across the seat and help your mama. So she gets to pull her pants down, and the 8-year-old catches the baby. 8. She does what's natural. The umbilical cord is wrapped around the neck. She untangles that in her little 8-year-old mind, which, y'all, that's a medical emergency. She holds the baby, wipes the baby off, and you ride the next 11 miles to get there for them to open the door and say, it's you again? Because you did this in 2013 and 2016. Like I said, this is not 1950s, 1960s. This is the year 2016. And you deliver not 1, but 2 babies along the side of the road. How? But that's what happens when you're in a healthcare desert. When you're living in a healthcare desert, that's an emergency, right? So the kids are doing well. Both of the babies are fine. That 8-year-old is now an 18-year-old, and she's a freshman at Miles College. We're super proud of her. But you say, Dr. Cree, I live in the city. That is not my problem. We're not a healthcare desert. So what should we be doing? We should be having conversations, guys. We should be having conversations that are hard conversations, but are important conversations. You go to the doctor, they give you all that paperwork, and you get to the part that says, what's your family history? You say, Grandmama, she had cancer. What kind of cancer? I don't know. She had cancer. And how old was Grandmama? I don't know, because Grandmama didn't tell her age. She said she was 50 until she died, and I think she was 103 when she actually died, right? Y'all grandmama was like that too. So we get in there as the provider, and I'm like, well, how do you not know what your family history is? But my question is, what is the cost? What does it cost us when our ancestors are silent? It costs us learning about our disease early, getting treatments earlier, maybe living a longer life. Because of that silence, we don't know that we need to be screened. It happened in my family. My grandmother had ovarian cancer. She was 70. We did not know she was 70-something until she died. And she said she'd come back and ride us like a Hank if we told anybody her age. You got this, girl. But we needed to know about ovarian cancer. As women, we needed to tell that story to our doctor so we can have screenings of all the other kind of cancers. So that's the cost. That could be the cost of the ancestor silence. But we're going to break that. So my challenge to you is at the next Thanksgiving, at the next Christmas, you go in there and you have that family meeting and you say, hey, write down what happened, what's going on with our physical health, our mental health, and pass that down from generation to generation to generation. So I told you I was from a small town, and I wanted to go back and be the doctor that took care of all the people. But my little family, we had a little baby named Zoe, and Zoe came with her own complications and was born with this one kidney. We had to decide, was 20 miles that way okay? Or 75 miles to the nearest children's hospital okay for us? And it simply was not. So we made the decision to stay in the city because we wanted to do what was best for our family. So you may have to have some decisions, some conversations, and make some big decisions to say, this cute insurance card is all that, but what if proximity is an issue? And what if you have not had the right conversations? So that impact leaves a lasting legacy. We want our children's children to be healthy, happy, and whole. You can't do that without having the conversations. Thank you.